So based on what you've told me about your health and your examination today, I agree with your GP that you could benefit from tonsillectomy, and I'm going to explain the procedure now. You'll come into hospital on the day of your surgery. The procedure takes around 30 minutes and you'll go home 6 hours after the procedure. I recommend you take 2 weeks off work, sport and study to recover. My nurse will ring you a week after surgery to check on you, and I'll see you 1 month after surgery. You'll have a general anaesthetic for the operation, and it's important that you follow the fasting instructions given to you by the hospital. You can continue your usual medications for asthma, reflux or contraception, but it's important to stop smoking for at least 2 days before surgery to improve the safety of the anaesthetic. After surgery, the better you eat, the better you heal. Aim to eat as normally as possible, particularly solid food including vegetables and drinking water. Where the tonsils were removed, we leave a raw area, and it's normal for that to look white for 2 weeks after surgery. It does mean that when you swallow it will hurt, and pain lasts for 2 weeks. Pain's often mild initially and can feel a bit worse toward the end of the first week before gradually fading in the second week. It's important to take pain relievers regularly to enable you to eat well. You'll be given a combination of pain relievers from the hospital and an explanation about how to use them. While you're recovering from surgery, it's possible to have bleeding from the raw area in your throat, and this can happen any time in the 2 weeks it takes to heal. Most people have no bleeding. Around 1 in 50 people that have their tonsils removed will have some bleeding, and it's often minor and stops on its own. Bleeding can be more severe though, and I recommend you stay within an hour of a hospital for 2 weeks after surgery so that you can get emergency care if you need it. It's also important to avoid medications that can promote bleeding, particularly aspirin-type drugs. If you'd like more information about this procedure, please ask me or my practice nurse, or look at our website.